Hello, I'm back in another video, and today we are going to talk about hyperpigmentation. Now, what is hyperpigmentation? And I have my iPad over here because I like to take notes. It's an overproduction of melanin in the skin as a result of inflammation, and this can come across in many different ways. It can be chronic or acute inflammation, and it's usually attributed to sun exposure, an influx in hormones and medications, but we're going to get all into that. We're going to get into the non-physical causes of hyperpigmentation in the skin. If you are dealing with hyperpigmentation and it's not going away, you're doing everything physical, you're using the salicylic acids, you're using the jojoba oils, you're using everything they tell you to use, and it's still not going away. Chronic inflammation is one of the leading causes of majority of chronic illnesses today. It is when the body's immune response is overworking and overreacting to something as simple as, for instance, in people who are gluten intolerant, gluten. How do you know that you have chronic inflammation? There are a lot of different ways that you can figure this out. Obviously, I would ask you to go to your doctor, but one thing is chest pains, abdominal pains, fatigue, insomnia, fever, joint pain, mouth sores, skin rashes, depression and moodiness is a big one. And a lot of the time for us women, they'll come at us for having depression and moodiness when in actuality it is as a result of chronic inflammation in our bodies. It can come about in many different ways. For women, it's going to be your PCOS, which is now PMOS, your PMS, your perimenopause and menopause. These are all things that can cause chronic low-grade inflammation in your body. Insulin resistance in PMOS, and in two types of PMOS, it is as a result of high androgen levels. Now, androgen is a sex hormone, specifically the male testosterone. And so when women have an increased level of that in their bodies, it causes irregular ovulation. And as a result of that, your body does not know what it's doing. And it's going to cause low-grade chronic inflammation. So please, if that's happening to you, get checked out. Now, if you are anemic, chronic anemia, and so if you're having hyperpigmentation that doesn't want to go away, most likely, if you are anemic, you might want to get your blood levels checked, your hemoglobin checked. As a result of that, also, lack of oxygen in the blood can just make pre-existing hyperpigmentation worse, and it can make it so that it doesn't heal. Yeah, it's making it worse. So get your levels checked. All right, y'all, this video got a little bit long, so if you enjoyed this video, please leave a like and leave a comment if you learned something, and meet me in part 2 to learn about how to combat your hyperpigmentation and your chronic low-grade inflammation with diet and other things. So get ready for that.